Hello everyone and welcome to this channel. First and foremost, I would like to mention that all our content is for educational and entertainment purpose only. Please seek medical advice or see a licensed professional for individualized care. Now, in today's video, our purpose is to create a language for mental health, which is similar to physical health. So it is easier for all of us to discuss mental health. Have you ever thought about being embarrassed to talk to anyone about your physical health? Most probably not. When it comes to physical health, people usually do not shy away to seek medical advice and talk to their physicians and doctors about it. But why is it that when it comes to mental health, there is always a stigma around it? We cannot pinpoint who to blame for the situation as to why it is difficult for anybody to talk about mental health. But we were never even taught in schools or in our workplace to talk about mental health. Until this very day, mental health is stigmatized in so many communities around the world. If we define what mental health exactly is, the WHO's definition for mental health states that mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It has intrinsic and instrumental value and is integral to our well-being. Now, mental health is about communication. It's about healthy relationships, coping mechanisms, knowing your family history, and taking care of your mind. Now let's talk about the 5 categories of mental health. Number 1 is everyday influences, which includes sleep, stress, self-esteem, and body image. Number 2 is environment, which includes your home, your workplace, your relationships, and your family biology. Number 3 is significant events like milestones, ending relationships, divorces, marriages, death, and major illnesses. Number 4 is mental health disorders, which includes anxiety disorders, eating disorders, bipolar disorder, and clinical depression, etc. And lastly, number 5 is developmental disabilities like autism spectrum disorders, learning disabilities, intellectual disabilities, and ADHD. To make the language around mental health easier, let's look at the spectrum for mental health, which typically would start from a person who is sane and has no diagnosis at all, and then people with mild mental disorders, and lastly, people with severe mental health disorders. So how do we categorize somebody on this spectrum? How do we know who belongs where? So let's just say someone who does not have any stressor of whatsoever, they would definitely fall into the same category, having no diagnosis, and that is where we all wish to be at. Fortunately, some people try to look for resources. These people would be considered to have mild mental health disorders, as they are trying to deal with it in a positive manner. Then comes the last category where maybe people did reach out and look for resources, or they do not even seek help. And it gets difficult to balance these things. It gets difficult for them to deal with the stressors in their life. They might need constant assistance and may not be able to balance and manage their mental health without the help of others. These people fall into the category of having severe mental health disorders. Now, when people do talk about mental health, one thing that I really want to clarify is that there is a huge difference when we talk about just emotions versus when we are talking about mental health disorders. For instance, we could be nervous, which is an emotion, could be temporary. We can be nervous about certain things. Let's just say you're going to take an exam. And before that exam, you might feel nervous, which is pretty normal. Whereas, on the other hand, anxiety disorders are a group of mental disorders characterized by significant and uncontrollable feelings of anxiety and fear, such that a person's social, occupational, and personal function are significantly impaired. And that is why being nervous and somebody having anxiety disorder is not the same. Similarly, let's say sadness, which is an emotion, and clinical depression, they are not the same. Body image issues and somebody having an eating disorder, these things are not the same. Thoughts of death versus someone planning to take their own life, those things are not the same. Bottom line is, we shouldn't be confusing these temporary emotions that we feel to actual mental health disorders. Sometimes it's also hard for people to express their emotions. What I would like to share with you all today is something called an emotional wheel. And then when you look at this wheel, you will see the different kind of emotions. A person can see which emotions are good and bad or whatever that you are feeling that day. And to make it easier for you to express how you feel, I would suggest that you all download this picture from Google or somewhere. I'll put the link in the description below, and just post it somewhere around your house and use it whenever you feel it is hard for you to express your emotions. And whenever you feel overwhelmed with emotions, just remind yourself that I own my emotions. My emotions don't own me. Remember, mental health is not a destination, it's a journey, it's a lifelong journey. We are all growing and learning. Instead of calling it mental health and having a stigma around it, how would it feel if we refer to it as brain health, mind health? Instead of calling it therapy, think of it as coaching. I do understand there is a huge difference between these two approaches, but it is all about the mindset and our perspective towards these things. Remember, mind over matter, people. Mind over matter. We all should pay attention to the power of mind, which has an immense effect on your body and your physical health. The choice in the end is always yours as to what to make of it. And I hope that it gets easier for everybody to start talking about mental health or brain health as normally as we would talk about our physical health. Let's make life easier for everyone. Thank you, everyone.